Now, from today, all patients attending accident and emergency at the Royal Sussex County Hospital in Brighton will be screened for HIV when having routine blood tests, unless they opt out. It's part of efforts to increase earlier detection and treatment of the virus. 110 people are thought to be living with undiagnosed HIV in Brighton and Hove, and half of the people seen by the hospital's HIV team last year were diagnosed late. The city is hoping to meet a target of ending new HIV cases by 2030. And as Mark Norman reports, one local charity launched 30 years ago says support for people living with HIV remains vital.
From today, all blood tests in Brighton's A&E will be screened for HIV. Diagnosing people earlier improves the health of the affected person, reduces transmission and helps prevent undiagnosed patients potentially becoming seriously ill.
We had again the opportunity to be able to identify those that are undiagnosed, that don't know about their HIV status. And that's critical because if you are diagnosed with HIV late, you're more likely to have problems with infections, nasty infections, and also cancers that actually can kill you. Whereas if you identify early, you're more likely to be on effective treatment without having all those problems.
Celebrating 30 years of specialist care and support for people living with HIV at the Sussex Beacon. For many of its volunteers and supporters, the NHS blood screening programme is a hugely significant and positive move.
I think this is a real game changer. You know, one of the biggest issues that the HIV services have experienced is that a lot of people come through different specialties, so sometimes testing or diagnosing can be missed, and having this opt-out initiative will change all that.
HIV still carries a stigma despite the fact early diagnosis and treatments enable people to live full, long lives. Stephen was diagnosed 30 years ago. The only treatment on offer then, a prescription for vitamin pills.
The medication has advanced so much that there's, any diagnosis from any illness is a concern. So it's still going to be a concern if you're diagnosed with HIV, but there is medication that you can take to deal with it.
This screening programme in Brighton, part of this trust's work towards achieving the global target of 0 new HIV infections by 2030. Mark Norman, BBC South East Today, Brighton.